Welcome to our CM International News channel. I'm Nathan. Nature Spotlight has a series of medical robotics in China. According to its article, in 2006, China highlighted the importance of robotics in its 15-year plan for science and technology. In 2011, in its 12th five-year plan, specifying that robots should be used to support society in a wide range of roles, from helping emergency services during natural disasters and firefighting, to performing complex surgery and aiding the medical rehabilitation. According to data from the Web of Science, between 1999 and 2019, the number of papers published by at least one Chinese author in the combined fields of biomedical engineering and robotics increased from 142 to 4,507, and spiked twice during that period. One peak was in 2008, 2 years after a robotic system from minimally invasive operations called Da Vinci was first deployed hospitals in China. The second was in 2017, a year after the first Chinese-designed robot from minimally invasive spinal surgery was approved for sale. In 2019, the number of Da Vinci systems installed in Chinese hospitals that year leaped to 59, up from only 8 installations in 2018. The series also features several leading robotics hospitals, research institutions, and robotic startups in China, including Beijing Jishuitan Hospital, Beihang University, Tianjin University, Tsinghua University, Tinavi Medical Technology, Sinovation Medical Technology, and more. In an article published on the World Economic Forum with the title "Robots Have Demonstrated Their Crucial Role in Pandemics and How They Can Help for Years to Come." As robotists at Texas A&M University and the Center for Robots Assist Search and Rescue, the authors examined over 120 press and social media reports from China, the US, and 19 other countries about how robots are being used during COVID-19 pandemic. They found that ground and aerial robots are playing a notable role in almost every aspect of managing the crisis. The authors also mentioned that during a disaster, robots do not replace people. The majority of robots being used in hospitals treating COVID-19 patients have not replaced healthcare professionals. These robots are teleoperated, enabling the healthcare workers to apply their expertise and compassion to sick and isolated patients remotely. According to China Daily, in order to strengthen weak areas exposed during the COVID-19 pandemic, and to ramp up the public health infrastructure and boost the region treatment capabilities for infectious disease, a plan was released by the National Development and Reform Commission, the National Health Commission of the PRC, and the National Administration of Traditional Chinese Medicine in May. Under the new plan, each provincial level region in China will have at least one P3 level biosafety laboratory, second highest level in a 4-tier system. Each city-level area will be equipped with at least one P2 level facility capable of conducting tests on pathogens of contagious illness and other health risk factors. And to improve the county-level hospitality, what comes first is to improve the operational conditions of fever clinics, emergency department in county-level hospitals, upgrade medical equipment, improve parking, medical waste, and other logistic support facilities, and improve the hospital diagnosis and treatment environment. On July 30th, an online webinar on how to improve the county-level hospitality was held. During the webinar, Wu Hang, director of the Department of Medical Devices from Xuanwu Hospital, Capital Medical University, and Pang Dan, section chief of medical department from Bobai County of the Guangxi Zhuang Autonomous Region. Two of them shared their understanding of how to achieve the goals that was stated in the plan.
国家制定了这样的一个诊疗的这样的一个方案哈，就救治方案，我觉得非常及时是吧？因为也是发现了我们在应对这个疫情当中发现了很多的短板漏洞是吧？那么在这里边对3级医院、对地市级的医院、对我们县级的医院都提出了一个具体的要求，而且呢给予了在设备有非常明确的这样的一个参考目录。同时的话呢，也进行了资金的保障啊。我觉得这个县级医院呢，一定要抓住这次机会是吧？充分的用足国家的这个政策是吧？把场地 把设备我们硬件的东西我们把它配齐了，是吧？那么逐步的提高我们软件的我们人员的这种能力，是吧？从而呢去提高我们整个医院的这种应对疫情的诊疗的这种能力。
这个方案的出台呢，那说明了国家对我们县级医院呢是高度重视。那对我们县级医院来说呢，我们要怎么样对接好这个项目呢？那首先的话，我想呢，应该要熟悉这个政策，要研究透彻这个建设方案。那怎么样充分利用国家对我们县级医院的扶持力度？怎么样全面的提升我们医院的防控救济能力？那我们县级医院话呢，要结合呢自己的实际情况，那来确定呢这个建设的规模还有内容。
Recently, with the COVID-19 pandemic under control domestically, local authorities across China, including those in Wuhan, Hubei province, and Beijing, are responding quickly, and some have proposed reforms to empower their public health system to better protect people's health. In Beijing, a 3-year plan has been released to comprehensively improve the city's ability to respond to public health emergencies, prevent and control major epidemics. A multi-tiered system will be established to monitor the public health emergencies, and checkpoints will be built at key places such as airports, train stations, and schools. Fever clinics at the community health center will also be improved, and the fever screening checkpoints will be set up at 189 community health centers to improve early warnings about infectious disease. Meanwhile, improved standards will be applied at the Center for Disease Control and Prevention in Beijing and its districts to improve their facilities and talent resources. Authorities will also draft a list of major public buildings that can be temporarily transformed into isolation sites and makeshift hospitals to patients in case of major public health emergencies, the plan said. In addition, besides the major public hospitals, it is important to empower the local medical institutions, especially during the initial stage of the pandemic. There are still much room for development of the basic public health service providers, such as community health center in many places across China. This is all for this time, and if you have any questions and would like to know and share more international clinical engineering related information, please feel free to contact us. This is CM International News Channel. We will see you next time.